Good afternoon, everybody, and welcome to our COVID meeting. Today is Wednesday. It is the 8th of July, and welcome back. My last opportunity to share with you was last Friday before the start of the holiday weekend. I was off on Monday. Enjoyed having a day off with family, but it's good to be back, and let's dive right into the updates. Here in the state of Florida, we are at 213,000 cases. We went up overnight, but I think it's more important to look at where we were a week ago to illustrate just how rapidly COVID is expanding in the state of Florida. Back on July 1st, we were sitting at 152,000 cases in Florida, and just 7 days later we are at 213,000. So that number continues to escalate at a very high pace. The number of fatalities are 3,841. Pinellas County is also seeing a rapid expansion of the number of COVID cases, with nearly 9,000 cases to date and 206 fatalities. Pasco County is stable with only 26 individuals who have passed from COVID-related issues. In the United States, yesterday we were at 2,948,000 cases, and the government predicts that today we will top over 3 million Americans inflicted with the COVID disease. The fatality count across America is 130,000. If we look at the testing, it's now at 107,000 with an 8.4% ratio of positive to negative, and our hospitalizations are sitting at 875 hospitalizations because of COVID here in Pinellas County. So those are the broader numbers for the community, and in terms of what's happening here at Regency, let's take a look at the quarantines. Currently in the IL, we have 30 residents who are under quarantine. The vast majority of those are because they went to the hospital and returned and are imposed in a 14-day quarantine. We have 5 over in the skilled nursing, and we have 23 in the assisted living. The remaining individuals in assisted living have had 2 tests for COVID, once last week and once the week before. All residents in the assisted living who have been tested have now tested negative for 2 consecutive weeks. They will be tested again this week, and if they all clear, those individuals will be coming off the quarantine list. Here in the IL, we have currently 15 staff members that are under quarantine. In the AL, we have 2, and in the skilled nursing, we have 9, for a total of 26 associates across the campus who are currently under quarantine because of COVID-like or flu-like symptoms. Testing in progress, we currently have just 1 IL resident that we are testing, and we have nobody in the assisted living or the skilled nursing. So we have been pretty successful in containing the spread of this virus within the community, and we will continue to watch these numbers, and it's one of the reasons that we've implemented the tighter restrictions and backed off a little bit on some of the personal freedoms in order to get a better control and make sure that residents here at Regency Oaks, both in the health center and in the independent living, are not unduly exposed to this virus that is expanding rapidly. Confirmed COVID cases, we are still sitting with 2 residents, one in the independent living who has recovered and 1 in assisted living who is deceased. And we have 8 associates who are confirmed positive for COVID, and all of those are under quarantine. In terms of looking at our individual testing, and again, this is a really important number because it talks about how those who are recovering and are testing negative will eventually overcome those who are positive or feeling ill, and that is the case here at Regency Oaks. In our positive test, we've had 2 residents test positive, 8 associates test positive, but in our negative test, we've had 116 residents test negative and 129 associates test negative. So that curve is flattened, and we are beginning to see some improvement in terms of testing results. So this afternoon I wanted to spend a little time talking about coughing and sneezing. You probably have seen some of the recent reports that have now confirmed that, just as we had always suspected, this virus is spread primarily through airborne contamination. And so I wanted to delve into that process of coughing and sneezing and just sort of share with you the latest from CDC and what they're saying about how dangerous coughing and sneezing is, and how the projectiles, the droplets, are creating the airborne contamination. Let's go to the presentation. Public health experts and elected officials have emphasized again and again that social distancing is the best tool we have to slow the coronavirus outbreak. The Centers for Disease Control and Prevention encourage people to stay home. If you must venture out, you should stay at least 6 feet away from others. The World Health Organization recommends a minimum of 3 feet of separation. Scientists are learning about the novel coronavirus in real time, and those who study similar respiratory illnesses say that until it is better understood, no guideline is likely to offer the perfect safety. Instead, understanding the possible transmission routes for the virus can help us see why keeping social distance is so important. So what you see in this 3D demonstration is the person here at the center of the group has just coughed or sneezed. And every time you cough or sneeze, you create projections. They are very small droplets that are transmitted out through various rings based on distance. You just saw that the recommendation, depending upon whether you're following WHO guidelines or CDC, is between 3 and 6 feet. And here someone has just sneezed, and you're looking at the droplets begin to spread. Scientists who study the transmission of respiratory illnesses like influenza say that infections typically happen when a healthy person comes into contact with respiratory droplets from an infected person's cough, sneeze, or breath. So as you cough, because these are projectiles, and they, based upon whether they are a sneeze or a cough and how violent that cough or sneeze is, they can travel at up to 200 miles per hour and travel a short distance of time. This simulation, created using real research data, tend to break apart. and you can see how they are breaking apart as the radius expands. The heaviest coughs release about a 1/4 teaspoon of fluid. These droplets dispersing quickly throughout the room. The simulation shows this spread over a 1-minute time frame inside a room of about 600 square feet. That's about the size of a kitchen and a living room. Under other conditions, the particles might behave differently. The CDC says that keeping at least 6 feet apart from others will help with these respiratory droplets and lower the risk of infection. They base this on the assumption that the transmission occurs mainly through large droplets because they contain more of the virus that fall in close proximity. But as this simulation suggests, and scientists seem to agree on this, droplets can travel much further than 6 feet. Here's our 6 feet ring, here's our 3 foot ring. These small droplets, known as aerosols, can remain suspended or travel throughout the air before they eventually settle onto surfaces. This way they are able to disperse over the next 20 minutes. And so when you hear about walking through a haze after someone in front of you has coughed or sneezed, this is what scientists are referring to. So it's not like, oh, it's only 6 feet, all these droplets have fallen, there's nothing for me to fear, I can safely pass through. You need to think of it more as a continuum, and these droplets are suspended in air and can be kicked up a second or a third time as individuals pass by and the traffic kicks the droplets back up into the air. In fact, some researchers have observed that particles from a cough can travel as far as 16 feet and from a sneeze as far as 26 feet. All of this suggests that keeping a distance of 6 feet or more can greatly reduce the possibility of transmission compared with being closer. The real takeaway is the further you get away, the more diluted the exposure is. Okay, it doesn't get better here. Coughing and sneezing may not be the only causes for concern. Studies of influenza have shown that infected people with mild or no symptoms may also be capable of generating infectious droplets through just simply speaking or breathing. For example, an infected person talking for 5 minutes in a poorly ventilated space, usually indoor, can produce as many viral droplets as one infectious cough. In recent days, public health officials have suggested that in addition to social distancing, more people should wear face masks to help slow the spread of the virus. Here's why. A face mask will disrupt the trajectory of a cough, a sneeze, or a breath, and it captures some of the respiratory droplets before they can spew out. A mask can also prevent large infectious droplets from landing on the nose and mouth, even though it provides minimal protection against inhaling smaller droplets. A mask can help protect you and others, so if you do need to leave home, wear a mask and be sure to keep your distance. Okay, so that was a really good information, and the second takeaway I hope everyone had is by wearing a mask, it really acts as a diffuser. And so if you are symptomatic, if you are showing signs of coughing or sneezing, by wearing a diffuser or a mask, it helps to keep those droplet contamination from spreading up to that 26 feet that you'd get with a sneeze if you didn't have a mask on. The one last thing I wanted to cover today, and we've talked about this before, but I wanted to go back and just give you the latest updates because it's changed a little. And this is called Mask Wearing 101. This is called Mask Wearing 101. Let's go to the board. So this chart depicts the 4 types of mask. The N95, which is the most effective, the surgical, the copper lined, and the homemade cloth. So N95s are bidirectional protection, maximum effectiveness. They are not washable. They are single use. This is recommended for all COVID caregivers, so healthcare professionals every day fighting this virus. These are the fitted, individually fitted masks that are recommended. The surgical mask, this is really common. It's effective in protecting others. It also is not washable. You typically can get 1 to 2 days of usage out of it, and it's recommended for non-COVID caregivers, non-clinical workers, and the general public. The copper-lined mask is a sort of a new entry into the field. It also offers bidirectional protection. It's only moderately effective. However, it's washable, and many people believe that the copper lining serves as an additional barrier against the virus. There's not a lot of statistics out there to support that, but we are seeing it as a popular alternative. The least effective of all masks are the homemade or the cloth mask. They are very effective in protecting others. They're less effective in protecting you. The advantage of a cloth mask is that they're washable and they are recommended for the general public. So if you are going out to Publix, so if you're going out to Publix or just out in the general public overall, a cloth mask is probably perfectly okay. If you're going to a place that has a little higher risk, like your physician's office, you probably want to jump up to a surgical mask. The same is true if you have an underlying condition or a predisposition to certain illnesses. If you are in a higher risk category, you want to try to get into a 95, an N95, or a KN95. A KN95 is the Chinese equivalent of an N95 mask. And they actually are rated as high as an N95 mask by the Center for Disease Control. So there's a little update on masks and how coughing and sneezing can spread the virus. I hope you found this information informative. We do have KN95 mask if you feel like you are going out to a physician's appointment and need to have a higher level of protection, and those are available from Leslie, our Director of Resident Services. So have a great afternoon. Hope you found this informative, and we'll see you again on Friday. Thanks.